Hi, I'm Dr. Georgia Witkin. I am Head of Patient Service Development at Progyny, and I'm here to welcome you to this webinar on how to talk to your doctor about fertility so your doctor can really hear you. And to help me, we have Dr. Tanmoy Mukherjee, who is one of the world experts on fertility. And we will go through some points that will help you talk to your doctor about fertility. And we'll see what you have to say about it as well.
I'll do my best.
Okay, so let's start from the beginning. Did you know that the average appointment with a physician in the United States for fertility is only about 20 minutes long? And the average doctor, not Dr. Mukherjee, of course, interrupts the patient about 18 seconds after they start talking about their symptoms. So the question is, if you have questions, if you're confused, if you want more information, how do you get heard? What do you do? And that's what we're here to help you with today. So let's start right from the beginning. How do you capture a doctor's attention? So I have a bunch of tips. I want you to listen to them and tell me which ones you think work best and which you agree with. Number one, tip coming from psychiatry professor, make eye contact with the doctor, maintain eye contact. That will help him focus on you rather than everything that he's doing.
I think that's terrific advice. You want to have a rapport, you want to hear the story, and then at the end, tell your story. Eye contact is a very important means of doing that to let them know that you're engaged. So I think that's a very important bit of advice to get the process, meeting a new physician, started.
Now this might sound a little manipulative, but I recommend to all my patients that they use the doctor's name often, which is a way, again, of calling attention, letting him know that you're focused on him or her, and maybe you'll get the focus back.
Makes sense to me. That way you're just more than a doctor, you're their doctor. You have a name, you have a label, and that helps in the mind of the patient-doctor relationship make you more than a doctor. It makes you a person. So I think that's great advice.
I also suggest that everybody signal to your physician if you're about to talk about something that really worries you, concerns you, makes you anxious, or you're confused about. Say something like, "This is important to me."
I love it when a patient says, "Doctor, this is what really concerns me. I had this when I was a child. I've been going through treatment. Menstrual cycle, I have this pain." It gives the doctor an opportunity, and that may be a time where the doctor will stop and say, "Tell me about that. Where does the pain go? What brings it on? What alleviates it?" But if you have a concern, it gives the doctor a chance to explore that concern with you.
Now here's a trick that you can learn from a therapist, because this is what we do with patients and you can do it with physicians. If there's something that's very important that the physician has said, repeat it back. It lets that physician know you're listening. It makes that physician hear it again. And it also stops them from doing anything but adding more. Because if they've said something and you say something, they're now off onto a response to you. But if you repeat what they've said, it's a way of underlining.
Emphasizing important moments during the conversation is critical. That way you know that you're both on the same page, that you're listening to the same thing. It's different. There's a difference between listening and being heard. And I think that when you emphasize a point by repetition, it helps move things along.
And this one I think you'll like. It's important to me. I tell all patients, when you're finished with the appointment, thank the physician for the time, for the information, because you know what? We like acknowledgement as much as patients do.
I think that's lovely. I mean, that's a great way to end the session. Get off on a personal level before you finish. And that way, next communication, Dr. Mukherjee, a prior conversation, it makes the physician feel good. They'll remember you. I think with a thank you, it's a great way to start the relationship. It's very easy. It's a very easy, basic thing that's often overlooked, unfortunately.
Yeah, and it's also an investment in the rest of your treatment.
That's right. Be nice to your physician. It doesn't hurt, right?
I get a lot of questions from patients going through fertility about what tone should they strike when they're with the doctor? What's the partnership really like? Many come in feeling sometimes like a victim, sometimes like a child themselves, sometimes like a failure. And how do I speak to the physician so I feel that they're listening? Here's what I say, and tell me what you say. I say, of course you want a respectful relationship. Do your homework so the physician knows that you care about what he's going to say. You're going to be asking smart questions. You're going to be putting into a context what he or she is saying. But I also say, and tell me what you think about this, think of yourself as a consumer, not a patient or a victim. You're paying money for a technology. You're coming to an expert that puts you on an even keel. Different, you're the expert, they're the consumer, but not a victim.
What is helpful in these situations, and certainly when a patient takes agency, it allows us to maybe focus on things that we could do differently. Certainly for a patient who's been under long-term fertility care, coming with the medical records, creating a timeline of events, things that may have happened previously that may affect future outcomes. I had a bad reaction to this medication, and well, what is the medication? I'm not sure. Well, that creates a lot of legwork, and there's going to be a big question mark there, and you really can't move forward till that's squared away. So you come with that medication, we can talk about it, it may be integral to synthesizing what the next step is in all this. Well, patients who have a reaction to that medication are going to benefit from doing it this way. So absolutely, come, be your own agent, tell the doctor what you've been through, if possible. Get those medical records. Why reinvent the wheel? They are a record of what you have been through. They will help establish what the next step is. It's very useful to create that kind of dialogue.
What do you think about this? Adding to that, I say also, bring a list. Bring a list of your symptoms. Bring a list of your questions.
Absolutely.
So that you won't be calling 7 times afterwards. You won't be forgetting. You don't mind a list, do you?
I don't. I have email. I have a lot of ways to contact me, but there's something about conveying that information in person at the first session. I always find it kind of cute that a patient will say, I'm sorry, I have this question. I go, no, please, tell me, let's go through your questions. Let's address your concerns. That's why you're here. You're worried about something. Let's find out what you're worried about. And that you have a list of questions really is useful. It's very useful.
Great. Here's my next question to you. I say to patients, take notes. Ask the doctor so that they won't think you're rude, but take notes. Ask them if they mind that you record, because afterwards it's so hard to remember. There's so much going on.
Absolutely. Record, write notes, use a pen. Ask a doctor if you want to take a recording of the session. I think most doctors would agree, not a problem. But if you just slam it on the desk as the session begins, it's a little off-putting. Ask the physician, may I record? And I don't think that anybody would have a problem with it.
And here's my last tip, again, for setting up the appointment. I tell everyone, try to bring somebody. 4 ears are better than 2. They're going to hear things differently. You may be too anxious to absorb something that your partner or your friend absorbs.
Bring a partner. Have somebody there to back you up. Fill in those missing questions, perhaps. So that way, after the session, you have somebody to bounce things off of. If it's not a partner, bring a friend. If it's not a friend, bring family members. It is very helpful in the process because you're going to have emotional support right next to you as you start what is a very difficult course of treatment. Fertility has its issues. It's good to have a partner.
Let's talk about what patients can insist on. A lot of patients have said to me, I really am confused by doctor speak. There are a lot of terms being thrown around, and I'm embarrassed to say I don't know what the doctor is talking about. Maybe I should have learned it in high school biology. What do you think patients can do if they're finding that they're becoming overwhelmed with doctor speak?
Doctor, stop.
Okay.
You have to just go over what you said in a little bit more detail. Absolutely. What didn't you understand? Okay. I have this example. I ask a patient to have a hysteroscopy done. Hysteroscopy, that's a surgical procedure. Why do I need to have that done? I've had ultrasounds, I've had HSGs, I've had a saline. Why do I need a hysteroscopy? And I try to explain as best I can. I use an analogy. Well, the analogy I use is you're over at somebody's house and you see a shag carpet. From a distance, that carpet looks perfect. But then when you get down on your hands and knees, you don't find little bald spots that need attention. Same thing with the uterus. A hysteroscopy, for example, is a means of looking at that uterus in more detail, finding those very small areas that may affect the way an embryo implants. So there's always a multitude of different ways to get your point across as to why something is necessary. And if at any point you feel that the doctor is not using, common sense linguistics or talk or speak or whatever you want to use, ask her to stop, revisit the issue, him or her to stop, of course, revisit the issue and explain it in different terms.
I'm glad you're saying that, because a lot of patients say that it's very hard to be fully honest when they're with the doctor. Sometimes it makes them feel, when they say, I don't understand.
That is the time you need to be honest.
Exactly. And if they're frightened of a procedure, if they're worried about the future, very often they say afterwards to somebody else, not to the doctor. Or they say, I didn't really click with my doctor.
Information is power. If you have a question about a procedure, stop, get more information about it. Because there's one thing about dealing with the unknown that's terrifying. But if you're dealing with something that's explained to you, you can do your own research when you go home, raise questions or allay fears, get more information to do that.
Right. So be honest, even if you're shy, even if it's difficult.
Please, please, please do not withhold anything from your physician, because that would be a huge problem.
Here's what I say. Look at the whole procedure through your eyes. Be clear on what you want. Don't keep looking at yourself through everyone else's eyes, because that tends to freeze people.
No. You have your own point of view. Again, take agency for your treatment, and you have to process it all, and that means understanding what's being said to you and asking questions about things you don't understand.
You might laugh at this. I say if you have difficulty speaking up, practice at home. Pretend that, your pillow is your physician, and practice. It's easier to hear yourself in the bedroom than to say it for the first time.
Bring somebody with you to the consult,
Yeah.
because in one sense, that person may never be seen again, but it'll raise the question. So they'll take all the heat for the initial consult. So good patient, bad patient. Bring them all to that same consult.
I want to know from your point of view, because I know from my point of view, when I'm doing therapy, if somebody is so anxious and nervous that they are talking in a monotone and they seem to be on automatic pilot, I am human and I begin to truly zone out sometimes. And I want to know, from a doctor's point of view, just as I gave a tip, vary your tone and stay involved, what makes it better for you to hear the patient? What do you need? Is it
I
humor?
love questions. I
Okay.
stop, I take a break, and I say, do you have any questions?
Okay.
And if they don't, I'm like, okay, we covered X, Y, and Z, just to refresh their memory. Now do you have a question? And if they still don't have a question, then I worry that I'm not explaining myself, because if you don't have any questions, then maybe I need to do a little bit more explaining.
So ask questions.
Always. Always. You have to ask questions so that it betters your understanding and it helps your doctor focus what he needs to be telling you.
And finally, a lot of patients say to me, keep your sense of humor. The
Always.
doctor needs a laugh once in a while, too. They can't have seriousness morning, noon, and night.
Well, listen, we try to keep it as serious as possible, but we do want to be optimists and we do encourage humor.
So you appreciate once in a while if the patient comes in with a little bit of sense of humor.
A little bit. Yeah, I like it a little bit, yeah.
Well, okay, I hope we made you smile.
Exactly. I don't need Don Rickles, but I'm good.
I got it.
Yeah.
I got it. Here's a tricky question. Suppose you've met your physician. Suppose that you feel it's not clicking. Suppose you feel he or she doesn't really understand you, or this is not the way you want to work, or you really want a second or third opinion. How do you speak to the physician about that, or do you just go do it?
Every pot has its lid. You will find the physician that works for you. So if at the first consult you don't feel like you're going to be clicking with that physician, find another physician. Find another physician.
A lot of patients are worried about doing that. They feel they may not be justified. They feel it may be rude. They feel that you may be speaking to other doctors about them. I say, first speak to your doctor and see if it can be straightened out. Most will not take it personally if you don't discuss it personally. Number two, I say write a note to the physician. Let them know why that you are moving on, why you're moving on, and then ask for your records. What would you say?
I think that honesty is very important in the doctor-patient relationship. And if you don't feel comfortable with the information that your doctor is providing, then your care is going to be suboptimal. I think that you need to establish a rapport with the physician. If at the first session you don't feel that this physician is what you need, then I think a gentle, I think I'm going to get another opinion, I'd like to explore my options. No physician takes offense to that. And we certainly don't gossip with other physicians about somebody who didn't continue care with us. That's not what we're here for.
Would you recommend that they first give you some feedback, like, my style is that I need to hear things slowly, or I need to digest it, or you're giving me a lot of information, maybe I'm getting overwhelmed? Or would you say just know yourself and find a different fit?
I think just know yourself and find a different fit, because I think, every physician has their style, right? And if the style is something that is off-putting, or you feel that it's not going to be useful in your particular situation, I think if the physician was outright rude, or they, absolutely bring it to their attention. But if it's something in their manner, if it's something in the way that they advise you, that's part of their style, if you will, I would probably just seek another opinion. Now, if there is a situation where the doctor just acts unprofessionally, by all means, write a note, send a letter. That's absolutely required, I think.
Good. So I think that's very empowering. Here you have a physician actually saying, you are the consumer, this is your physician, make sure the fit is good, don't feel guilty if you move on.
Absolutely.
I'm happy to hear you say that.
There shouldn't be any guilt involved.
Yeah. Sometimes fertility treatment can take a long time. Sometimes it can take many procedures. Many of you have been through this. You've been through many, many treatments, and there seems to be always another step. At what point would you advise patients to reassess?
That's a very good question, and unfortunately it's a very difficult question. I think fertility therapy, compared to other fields of medicine, it takes a long time because you have one opportunity a month. You have one opportunity to release an egg and fertilize that egg, and it takes time, and the frustration level builds. If you've been through the IVF procedure and it doesn't work, get a follow-up, understand why it didn't work. There's a lot of moving parts to this. Is it a matter of embryo quality? Is it a matter of anatomy? Is it a matter of other coexisting medical conditions? It takes time to work through this. And I think a realistic cap on this is, if you're not successful within a year of starting fertility therapy, then maybe you should start thinking about what the options are. But you have to give fertility therapy some time to play out. Some of the most common fertility therapies need to run for 3 or 4 months before you get more aggressive. Don't lose patience with your practice at that point. They are performing medicine according to the current standards. But if it gets past a year, absolutely say, doctor, what more can you offer me? Why has this not worked? And if you get an answer that makes sense to you, then you continue. If you don't like what you hear, it's time to find another practice.
Yeah. If you're in fertility treatment, you probably know a lot about what you want in a doctor. If you want to know what the physician wants in you that will help you get the kind of attention you need, basically, they say they want a certain kind of relationship. They want a respectful relationship where they know you've done your homework, you know what questions you need answered, you've looked at the research, so what they say is going to make sense to you. And that kind of attitude you can generally get by seeing yourself as a consumer of technology and medical services, not a victim or a patient. So if you have any tips about how to help when you're at an appointment that doctors stay focused on you, please let us know. These webinars are for you, and happy to have you here.